This is a procedure demonstration of Piccolo Medical's ECGuide used with the PM2 system. The ECGuide is FDA cleared as an alternative to chest X-ray in adults, pediatric, and neonatal patients, and is compatible with any catheter with a standard Luer lock. In this demonstration, the ECGuide is used for bedside tip confirmation of a PICC. At this point in the procedure, the vascular access specialist has already placed the ECG skin electrodes, verified that the external ECG is streaming on the PM2 system, and the patient has an identifiable P wave. For single-user operation, the ECGuide bundle pack includes a sterile screen cover to allow interaction with the PM2 system touchscreen while remaining sterile. The PM2 system comes preloaded with the GE-vScan Air app. Pairing a vScan Air wireless ultrasound probe is simple and gives the clinician a single, integrated display for both venous access and final tip confirmation. Here we have a right arm basilic vein insertion, and at this point in the procedure, the vascular access specialist has already set up the sterile field and draped the patient, and is performing final vein assessment using the vScan Air app on the PM2 system monitor. So far, everything you are seeing is unchanged from our standard catheter placement technique. We will see later in the demonstration that the ECGuide integrates seamlessly into your standard PICC insertion workflow with only 3 easy steps. Once vascular access is achieved, switching back to the ECGuide app is just 2 quick taps away. We are now ready to perform final catheter preparation. First, cut the PICC to the desired length. The ECGuide can be connected directly to the PICC hub at this point if no stiffening stylet is needed. In this demonstration, we will show how to use the ECGuide with a stiffening stylet in place. First, attach the T-port provided in the PICC kit and flush the PICC lumen with normal saline. Next, insert the stylet into the PICC for added stiffness during venous navigation. The ECGuide can then be attached to the T-port and flushed with saline. Once the ECGuide is connected to the catheter, simply remove the tape from the ECGuide electrical wire and pull it apart, tangle-free. Finally, plug the ECGuide connector into the PM2 system without compromising sterility, thanks to the integrated finger guard. We are now connected and ready to insert the catheter and begin our advancement towards the cavo-atrial junction. Once the catheter is in the vein, the intravascular ECG will show up on the PM2 system. In all, the ECGuide setup consisted of 3 easy steps. Attach the ECGuide to the catheter hub, flush with normal saline, and plug into the PM2 system. The PM2 system incorporates an advanced ECG data filter to ensure the ECG waveform is accurate and P-wave changes are easy to interpret. As the catheter is advanced towards the CAJ, an increase in the P-wave will be visible on the intravascular ECG signal. If the catheter is advanced too far into the right atrium, a negative deflection will be visible, indicating that the catheter should be retracted until the maximum P-wave with no negative deflection is achieved. Once the maximum P-wave is found, the clinician will take a max P screenshot and enter the exit site centimeter mark to document the final tip position confirmation. At the end of the case, the PM2 system provides a procedure checklist to ensure all best practices for bedside confirmation were utilized. A procedure report can be generated at a simple click of a button, which can then be either wirelessly printed or transferred to the patient's medical record in accordance with institution policy. The ECGuide can also be used anytime after placement to check for catheter migration by following the same 3 easy steps. Connect the ECGuide to the catheter, flush with saline, connect to the PM2 system, and check for maximum P wave. Thank you for watching this PICC insertion demonstration with the ECGuide and PM2 system.